Topic 12. Heart Transplant with Betty Newcomb. Listen to me for the words. Transplant. Recipient. Pro and con. Feasibility. Operation. Buddhism. Loath for. Transfer. Organ. Stem. Cardiac. Muscular. Artery. Dilation. Contraction. Surgery. Tissue. Corneal. Cornea. Eye bank. Eliminate. Surgeon. Sophisticated. Kidney. Fashion. Recuperation. Inborn. Survive. Qualm. Restrict. Arrangement. Contingent. Availability. Donor. Tragic. Drawback. Clinically. Hemorrhage. Affect. Permission. Bequeath. Equipment. Interchangeably. Age-wise. Gender-wise. Fatal. Ailment. Prone. Post-operative. Respiratory. Pneumonia. Autopsy. Dedicate. Deserve. Immeasurable. We have had one case of heart transplant in Japan. Unfortunately, the recipient of a new heart died. Because of his death, people have been debating pro and con on the question of the feasibility of the operation. Some have even questioned the morality of it. Perhaps we Japanese who have been brought up on Buddhism are loathful to the idea of transferring an organ of one person to another. Most fears in life, however, stem from ignorance. So let's get at the root of the matter to begin with. Betty, define heart transplant.
All right. The word heart comes from the Greek word kardia, meaning cardiac, the hollow muscular organ that receives blood from the veins and sends it out through the arteries by alternate dilation and contraction. In other words, a pump for the fuel of life, blood. The word transplant, on the other hand, stems from late Latin transpare, a verb which is formed by trans and plant. This, in surgery, means to transfer tissues or an organ from one individual or part of the body to another.
Medical science has been conducting all kinds of transplants, hasn't it?
Oh, yes. For many years there have been transplants, countless transplants of different types, such as corneal transplants.
What is a corneal transplant?
This is the transferring of the cornea of a healthy eye to the eye of a patient who is going blind because of an eye disease, or, say, is in danger of losing his or her sight due to an accident.
Wait a minute, Betty. Where do you get healthy eyes?
Oh, these corneas have been taken from persons deceased, and in many instances have been left to eye banks by their owners for just this purpose. They are kept in a frozen state until needed.
Yes, I've heard about eye banks. Thanks, Betty. My initial fear about transplants of human organs has been eliminated. Now let's talk about heart transplants. When and where did the first heart transplant operation take place?
It was just about 3 years ago when, in South Africa, a surgeon performed the first heart transplant. This was only the beginning. More recently, he performed the same type of operation on another man, a dentist. This recipient lived 19 months. He died very recently, but had enjoyed the gift of life because a surgeon was brave and daring enough to try to help humanity. He paved the way for more and more sophisticated operations of this sort. We are now becoming accustomed to reading about kidney transplants, bone transplants, and the like in our daily newspapers.
Can a person with someone else's heart live normally?
Oh, yes. The dentist I mentioned before the operation had been forced to give up his practice. He was unable to drive a car, play golf, or live in any kind of normal fashion. After surgery and his recuperation, he did all of these things, including dancing.
I can't dance even with my own heart inside of me.
There have been many heart transplants in different countries.
Not all of them have been successful, have they?
No, because the human body will sometimes reject foreign matter.
Foreign matter?
Something which is not an inborn part of the body. Although not all the operations have not been successful, the mere fact that one survived for 19 months has proven that with more study and medical know-how, the day should soon arrive when these recipients will be able to go forth with no qualms for the future and assume a truly normal way of life.
Until that day arrives, though, most people will not want to take a chance, I'm afraid.
We are taking chances every day, aren't we? The minute I leave the house in the morning, I face dangers coming from all around me. We must look at life itself more positively. Imagine, if you will, that you or a member of your family is suffering from what used to be an incurable heart condition. The only future for the victim is one of complete quiet, bed rest, no activities, no excitement, no sports, just pills and a restricted diet. And age has nothing to do with it. This can happen to people of any age, old or young. It makes no difference. This was what used to be the fate of almost anyone who suffered from a cardiac condition, and certainly did not hold out too much hope for any normal and enjoyable way of living. Now, if the patient wishes, he or she can make arrangements for a transplant, contingent, of course, on the advice of his doctor and the availability of a donor.
I was just going to ask. Even if a person wanted a heart transplant, he will not be able to get one until someone else is dead. A deceased person's heart is dead, isn't it?
Not necessarily, Toru. A perfectly healthy person may die instantly in a traffic accident. This is a tragic thing, but he leaves a healthy heart to be given to another person.
Oh, I see.
The big drawback is that the number of donors does not equal the number of patients. And unfortunately, this is a serious problem. And as a result, the patient must sometimes wait an extended period for a donor. These donors must have a clinically perfect heart, and usually the organ is removed from the body of someone who has died, as I said a while ago, in an accident, or perhaps has died as a result of a brain hemorrhage. But it is always from a cause which in no way has affected the heart.
There are so many accidents nowadays that you should have no difficulty finding donors.
You must get the permission of the deceased's family. Many people do not want their dead used in these operations, but more and more people are bequeathing their hearts to medical science for just this purpose. When this occurs, of course, the family can do nothing about it.
Can an old person's heart be used for a transplant?
In heart transplants, age does not seem to be matched. Evidently, the heart, which is a very tough piece of equipment, can be used interchangeably, age-wise as well as gender-wise.
Earlier, Betty, you talked about the human body sometimes rejecting foreign matter. We've heard of cases where the recipient developed some fatal ailments.
Yes, although the transplant has been a true success in many instances, the patient has been prone to post-operative respiratory ailments. Pneumonia seems to be a common cause of a recipient not recovering. This has been shown in the autopsy reports. As in all other pioneering endeavors, there has been initial failures in heart transplant, and the score is not perfect, but the percentage of new life and the hope of a second chance is a picture of bright colors.
Yes, and more power to the doctors.
I am glad you mentioned the doctors. These dedicated men and their highly trained assistants deserve a lot of credit. They are the people who are not satisfied at just being top cardiac specialists. They have and are having such visions in this field of medicine that they have dared to go ahead and use their training and combine it with pioneering in their careers. We owe these men in white immeasurable thanks.
Idiomatic English. Please repeat after me if you like. Bring up. That woman has brought up 4 children all by herself. In other words. In other words, you'll be out of town all next week. In other words, I was fired. In danger of. They warned many times that the bridge was in danger of collapsing at any minute. Transfer to. My father has been transferred to the branch in Boston. Become accustomed to. The boy soon became accustomed to his new environments. Give up. You are losing weight. You should give up smoking and drinking. Take a chance. I'll take a chance on the new idea. Don't take a chance going out in this weather without an overcoat. Have nothing to do with. I have nothing to do with you. Make arrangements for. I'm making arrangements for the party tonight. As a result of. The janitor was injured as a result of the explosion of the boiler.